Hey, I want to demonstrate a sequence to improve thoracic rotation. We're going to start with assessment first, move into some corrective movements. I've chosen this position because we're going to get into split kneel, which can be really effective for some stabilization of the whole system. First thing we're going to do is just check rotation. So we're going to come onto hands and knees. Back up a little bit here. We're going to first start with hand behind the back, and we're going to rotate to the right. Just do this a few times. Notice what it feels like, how far you can move your shoulder. Then we're going to bring the hand behind the head and do the same thing. Switch sides, hand behind the back, and rotate. Then bring the hand behind the head. Now from here, we're going to come up into tall kneeling, and we're going to bring one leg forward. When we do this, we want to make sure that the pelvis doesn't rotate forward as you bring the leg forward. So bring it back. You want those as-is markers on the pelvis, our headlights, facing forward. As much as you can, you want the pelvis level as well. So from here, we're going to go into some rotation. The first thing we're going to do is just throw some punches just to start an easy warm-up. So we're going to take the right hand, right leg, rotate. So we're going to rotate to the left. Come back to center and rotate right. One more. From here, we're going to come in and do some rotation. We're going to come down inside the front leg and open up with the left arm. Turn your head as you do so and back down. We're going to come up to tall kneel, and we're going to get more mid-thoracic rotation, bringing the arms up to 90 degrees. We're going to rotate toward the front leg, and we're going to rotate the other way. We're just going to do 5. Rotate. And we're going to go 5 the other way. We're going to bring the arms down, and we're going to switch. So come back to tall kneeling. Bring the other leg forward. As you step forward, again, you want to be in 90 degrees. Ankle, knee, hip. And then from here, you want to make sure that you can square your pelvis and get it level. From here, we're just going to start with the punches. So the leg that's forward, we're going to move that left arm and throw right. So we're just going to rotate here. And opposite way. One more. Back to center. We're going to come down to the inside of the front leg and open up and rotate. One more. We're going to come back up to kneeling. Check your landmarks and mid-thoracic rotation to the left. And then to the right. Okay, from here we're going to check again. Coming down onto hands and knees. We're going to bring the right hand behind the back and rotate. Notice if you have more motion. Right hand behind head. And switch. Hand behind back. Rotate. And hand behind head. Okay. And you might notice that you got a little more motion just from doing 5 each side. I would recommend going into whatever you can tolerate, up to 10 repetitions on each side, and then sequence through. There are lots of things you can do to free up your thoracic spine. You can get in and work the balls at your back, or get in and use a half foam roll and roll your back a little bit. So hopefully you have a little more motion after this little bit of movement.